Okay, so I'm just leaving my surgeon's office, and the consensus, well, there's a lot of things. So we're at the point of scheduling the mastectomy. My cancer is on my right breast. I have talked to my oncologist about possibly doing a double mastectomy. Reason being is because I took a genetics test with my oncologist's office. Given my age, they always want you to take a genetics test to see if you are genetically predisposed to breast cancer. So I took my genetics test, but the results from that take 3 weeks to come back in. My concern is I don't want to have the surgery done on my right side where the cancer is, only to find out that I have to get a mastectomy on my left as well. And if my genetics test comes back positive, then I'm going to have to get a mastectomy done on my left breast. And I don't want to do two separate surgeries. So we're trying to figure that out. My surgeon has to find out if my insurance will cover the bilateral mastectomy. He's saying that he doesn't think it's a problem given my age, that the insurance should cover it. We also have to find out if my plastic surgeon will perform the double reconstruction, because when I saw him, all we talked about was reconstruction on the right breast. So this would now be him having to reconstruct both. What else? He talked about drains and closing the wounds and stuff like that, but then he was like, but I don't do any of that. That's your other doctor. And I'm like, which doctor? I have like so many doctors. So he was saying that that's my plastic surgeon, who there's going to be some drains in me. And once my surgeon hacks off my breast, it seems the plastic surgeon comes in and does all the rest of the work, like closing up the wounds and everything like that, putting in the tissue expander and closing everything up and putting in drains and stuff like that. So the issue with scheduling now is my surgeon seems to only work on Wednesdays, and he is booked every Wednesday through the month of February. So this is where it gets funny. So his nurse is saying that, she wants to get it in sooner. She wants to get it in between the second, no later than the third week of February. But, we have to find out if the stars align, because we have to also find out which day the plastic surgeon works. So she's saying that, a lot of times some plastic surgeons only operate on Fridays. So you have to line up all the doctors' schedules so that they all can work to get this done. So I will be hearing back from the surgeon's nurse to find out my exact date. Again, it sounds like it's going to be either the second week of February, not the first week, because that's coming up in like a few more days, but either the second or the third week of February, which I should also say neither are in time for my genetic test to come back. My genetic test doesn't come back until the 17th of February. So this is kind of going to be a gut decision, me deciding to do the bilateral mastectomy. I did speak to my oncologist. I feel like I'm giving you guys too much information, and I haven't done my backtrack videos yet, but I did speak to my oncologist this morning about giving me a referral to a genetics counselor so that I can meet with her or him whatever sex the genetics counselor is, to determine what are my risk factors. Is it likely that I'm genetically predisposed to cancer? So there's a whole lot of balls that we're juggling up in the air, but my thing is, the sooner we can get this done, the better. Recovery, I asked him, like, how long is recovery? He's like, that's a good question. I'm like, I know, that's why I asked. But recovery seems like it's gonna take, he was saying about 2 weeks. He was like, you know, with your drains and everything like that. And I was like, sitting there making faces. I was like, this all sounds gross, like ill. But yeah, he was saying that recovery should take 2 weeks. He was like, maybe 3. He went over again the risk factors of having my auxiliary, if I have to have my auxiliary lymph nodes removed. He went over the risk factors again with that. So because he's always going over the risk factors with that with me, I'm always like, you know, well, just don't damage a nerve. How about that? So I was like, you know, how many times have you damaged a nerve? He was like, I've never. And I was like, okay, well then let's cross our fingers. He's like, yeah, but I have to tell you the risk. I was like, you seem to harp on the risk of this too much, as if I have a choice. Like, I'm going to say, if it comes back that I have cancer in one of my lymph nodes, like, I'm going to say, you know, leave that cancerous lymph node there. Like, I have no choice. So us discussing how you can permanently damage my nerves and mess me up is just not helpful. So yeah, that is everything for now. What we're going through, we're just waiting to plan this mastectomy, get this done, cut off this cancerous boobie, and possibly cut off the mate, who's perfectly healthy, but you know, she might have to go too. So I guess when I get a date, scary, I'll be back in contact with you guys. In the meantime, I know I have to do those backtrack videos to get you guys caught up to how we got to this point, and I'm gonna get that done. I'm gonna try to get that done today. It's just been really busy. I closed down my studio, so this is the stuff that you see in the back seat. I had to close down my makeup studio because I'm not gonna be able to work for a while. So yeah, that was a little sad. I had to shut down shop this weekend. But yeah, we, as in me, as in I, have a road ahead of me. So this is all new. I feel like I keep making that face because just that's all the expression that I can give you right now. Like, geez, this is scary. But so stay tuned for more to come, I suppose. See you guys next time. Bye.